Good afternoon. My name is Lance Fleming. I'm the Chief Communications Officer for the Abilene Independent School District. I want to welcome you here this afternoon. Before we get into what we're going to be talking to you about, I want to introduce a few people who are going to be speaking to you this afternoon. The Mayor of the City of Abilene, Anthony Williams, the City Manager, Mr. Robert Hanna, the Abilene Director, AISD Superintendent Dr. David Young, Wiley Superintendent Joey Light, and United Way President and CEO Dr. Kathy Ashby. I want to also recognize a few people in the room with us today: school board members Sammy Garcia and Billy Enriquez, school board member Travis Craver, CEO and President of Hendrick Medical Center Brad Holland, Chief of Staff at Hendrick Stephen Lowry, Dr. Stephen Lowry, and Chief of Police Stan Standards. Thank you all for being here, and I'll welcome Mr. Williams to the podium.
Well, good afternoon. The executive order that we signed on Monday went into effect today. One thing that we communicated on Monday, as we receive additional information feedback, if need be, we would make some modifications. And so moments ago, I signed a new order allowing us to make that needed modification. I want to take time and communicate the things that have transpired since we met together on Monday. I've been in constant contact with the mayors of West Texas and Wichita Falls. You may know the two confirmed cases in Lubbock on yesterday. It is important to note that both of those cases were travel related, not community related, as well as the one in Wichita Falls that was confirmed on this morning, being travel related and not community related. Mr. Hanna and I met this morning with the staff, the medical staff at Hendrick Medical Center, and Dr. Lowry will come up and speak in just a bit after Mr. Hanna and provide more detail. What we decided to do is really lean on them like we've been doing, allow them to provide some feedback. Additionally, Mr. Hanna and I joined in on a phone call with Vice President Pence, as well as other mayors across the country. They also gave directives. I've also been in conversation with Jody Arrington on today, and the congressman wants us to know that an order that I signed, by the way, it goes from 250 to 50. So from 250 to 50. Wichita Falls, Midland, Odessa, and Lubbock are all at 50 now, or will be at 50 within the next 24 hours. So Congressman Arrington acknowledges that that cap on groups will have an impact and will adversely affect a certain segment of our community. His counsel, and we concur, is that it does create hardship, significant for some in the short term, but if we can get past this, it'll eliminate, and Dr. Lowry will speak to this a bit also, things we have to do in the future. It will curtail it, and so that's some of the rationale behind that. Doug Peters is working with Calvin Davis. Calvin Davis oversees the SBA for this region with an opportunity to help the business sector. Spoke to a couple of retailers on yesterday, and they've already seen a reduction in revenue of around 20%. And we anticipate that being exaggerated. And so there are some mechanisms that are in place that may have an opportunity to assist in the interim some of those businesses. One thing that we have talked about is we want to communicate to this city that we are prepared. There has not been a day where we've not been engaged having conversation about the things that we ought to be doing. We are prepared. We don't want to cause panic, but we do want to be responsive. And we want to be sure we do everything within our power that we don't promote the spread of this virus. Again, there are no confirmed cases in Abilene, Texas. We have 2 in Lubbock and 1 in Wichita Falls. Save those, there's not any confirmed cases. I think our medical care professionals anticipate we will have a positive case in our community. And when we do so, we're going to react. Embedded in the declaration, when we do have our first case, we will go to 10. We're going to follow what's been communicated to us through our president and through our governor and through our professionals here in our community. This is something brand new for us. There's not any kind of handbook that we can turn to look and see what we ought and need to be doing. But what we can do is do the best we can as long as we can. And I have faith not only in those men and women that are part of this process. As a Christian, I have faith in God. And I believe that we may have additional obstacles and issues we have to deal with, but as a community, I believe that we are going to be okay. When needed, we will provide additional information. I can't, Brad, your staff, as well as Abilene Regional, I can't thank you enough for your wise counsel. And Blair, please mention the congressman. I appreciate his mentorship. And I appreciate each one of you being patient. Mr. Robert Hanna will come before you and communicate some things you ought to know about city services and how that may affect you, followed by Mr. Dr. Lowry, who will talk about some things that we want you to know also from the medical part. Mr. Hanna?
Thank you, everybody. Good afternoon. It's been a long few weeks. I want to reiterate what the mayor has said is that effective 8 p.m. on Sunday, gatherings will be 50 or more will be a violation of the mayor's order. I know that impacts people's lives in a very real way, but what we are trying to do is to, as we've said before in the past, flatten the curve. In order to do that, we have to stay in front of this level of infection. And one of the things Vice President Pence said this morning, or this afternoon in the conference call, was that it's important that we are well in advance of this virus being present in our community. We don't have a confirmed case. I think it's naive to think we don't have people potentially carrying COVID-19 now in the community, okay? We mentioned some of the testing requirements and some of the testing challenges, but the reality of it is, I think, based on what we're seeing in our public health department, and I think maybe what Hendrick is seeing, we're okay at this point in time. We are well advanced of the spike. So I'm using my hands because I'm not like Ross Pro. I don't have flip charts and markers. Okay, for y'all that might remember that. But the curve, it's an exponential increase. Okay, so we're here at the base of this increase. And if you stay in front of this through social distancing, you have the ability to avoid potentially this exponential spike. At the very least, you end up lowering that spike, and you make sure that the medical facilities are able to meet the needs for the critical care that they're going to have to provide to patients with higher risks. So again, 8 p.m. on Sunday, we'll limit gatherings to 50. The first positive test case that the Abilene-Taylor County Health Department has, at 5 p.m. that day, we will reduce gathering sizes to 10 or less, which is going to have an even larger effect, and we recognize that. But again, it's trying to stay ahead of that curve. Some exemptions are in place. Grocery stores are one of them, okay? We don't need people piling into the grocery store and buying everything off the shelves. The supply chains, those are all going to continue to run. Water and sewer, that's all going to be operational. This is not a tornado event, so we don't need to act like we need to prepare for a tornado or a hurricane, because that's not what's going on here. Office space, residential buildings, all those will be exempt. For those that have multi-story office spaces, they will be exempt from that. as well as hospitals and medical facilities. So what is the city doing? Effective Monday, I want to give people an opportunity, and also my staff an opportunity to implement some of these changes. Effective Monday, all public libraries are closed. The municipal court will be closed to the public effective 8 a.m. on Monday. Ticket payments can be made online at abilenetx.gov. There's also a drop box at City Hall on 5th Street. All ticket due dates will be deferred for 60 days at a minimum, depending on how long this lasts. Customer service, or some people call the water office, they will also be closed to the public starting 8 a.m. on Monday. Utility payments may be made online at abilenetx.gov or placed in the utility payment drop box. Requests for new utility service will be available online. We're standing that system up, and you should be able to start service online. The issuance of all special event permits and solicitation permits are temporarily suspended. And we won't be issuing any more solicitation permits or any more special event permits. And then we are discussing how best to do this next thing, but we anticipate closing City Hall to the public on Monday as well at 8 a.m. The details of that will be released prior to the end of the week. City Hall is a nexus for government services for many in our community, and we want to make sure that we maintain and provide those vital services. How best to do that is something that, frankly, we are still discussing. But my commitment is if you need to get something done at the city will be there to help you get that done. We're not closing shop and going away. We're simply trying to make sure that we curb the level of infections. And we're making sure that the workforce that serves the public is protected so that they can provide the essential services that we all depend upon. At this point in time, I'm going to change a little bit from the game plan that the mayor just announced and invite Superintendent Joey Light to come talk. You're next, buddy. Yeah. Unless you're going to go ahead? Well, my notes are wrong then. Dr. Lowry, come on up.
Thank you. So I imagine many of you guys are more educated on the coronavirus, COVID-19, much more so than you were probably a week ago, as is the rest of the United States. It's most likely that kids and asymptomatic patients are carrying it, and they have mild symptoms or maybe no symptoms at all. And so they travel around, interact with friends, family, and that's why you see an exponential growth in the number of cases across the world. It's spread like wildfire, starting in China and then through Europe, and now it's made its way here, which we've expected. But I'll say that there's a number of things that have been taking place behind the scenes in the city, at the hospitals, at our hospitals. Hendrick, I know, has made many plans and already implemented many different things to try to mitigate this risk and slow the progression of the disease. It's a new virus, so none of us have immunity to it. And because of that, that's one thing that makes it so contagious and makes it spread the way it does. And until it goes through our communities and we develop immunity, then the best we can do is try to, a new term many of us have learned is flatten the curve. And I think we understand what that means. As far as the strategies being implemented at the hospital, all of those things are designed to make sure that we have adequate resources and capacity to try to be ahead of anticipated needs for our community. And again, like I said, those plans have been in the works for a long time, not advertised, but in the works for a long time and are being implemented actively. So I'll ask my fellow Abilenians to also be proactive and try to help flatten this curve. Things that have already been done, we've suspended schools. It's my opinion and several of my colleagues' opinion that we need to continue this suspension, most likely indefinitely, until we see how quickly or how this spreads in our community. Because as I said earlier, young kids, I believe, are probably the vector, the ones that are asymptomatic or mildly symptomatic. And when they interact, it spreads throughout the school kids, and they take it home. So that is a reason I'm encouraging that we continue to suspend the schools. We can all continue to social distance. I know my family's at home getting reacquainted, playing games that they haven't played together in a long time, and running out of movies to watch on the DVD. But social distancing also helps to slow this progression. Online services, as Mr. Hanna said, are available for a number of different things, not just city services, but there are other opportunities to utilize online services. And I would encourage our community to, as much as possible, use those and just try to minimize interactions that are unnecessary. Those are some of the things that our public can be doing. And then at home, or when you do go out and interact, we're going to have to go to the store to get supplies and necessary things that we need for our daily lives. But when you do, be mindful. You don't do what I did and walk up here and put your hands on the podium. A habit, but we're all developing new habits. You don't touch things unnecessarily. You wash your hands, and when you are out, don't touch your face. Simple things, simple measures that can make a very big difference to our community and to ourselves. If you have some mild symptoms, not sure but concerned, you're most likely safest and best off just to stay home. Treat yourself with the Tylenol, the ibuprofen, the over-the-counter medications. Again, mild cold, a lot of people, this tends to be like a mild cold. And we don't necessarily go to our physician's office or seek medical attention when we have mild disease. I would encourage you to consider the same. If you're having more symptoms, more severe symptoms, and feel the need that you need to be evaluated, call your physician's office first. Reach out to them and say, hey, I've got fever, I've got this, whatever your symptoms are, and let them remotely help guide you to the proper area or procedure that needs to take place to make sure that you are evaluated and taken care of. Again, our goal is to flatten the curve, and we can all work together to try to do this. We want to limit our social interactions and do our best to work together and try to be understanding in what's going on and some of the measures that are being taken. I'd encourage everybody on this issue. We need to think globally but act very locally. And I thank you for your time.